Crohn's disease overview. Crohn's disease is a chronic idiopathic transmural inflammatory disease of the digestive tract with skip lesions but with a propensity to affect the distal small bowel. Pathophysiology. Pathological hallmark is focal transmural inflammation of the intestine. Aphthous ulcer, the earliest lesion, superficial ulcer up to 3 mm in diameter, and are surrounded by a halo of erythema, typically arise from the lymphoid aggregates. Non-caseating granulomas are seen in 70% of cases. Highly characteristic of Crohn's disease, can be found in both active areas and apparently normal intestines, in any layer of the bowel wall, and in mesenteric lymph nodes. Aphthous ulcers may coalesce to form either stellate, serpentinous, or linear or transverse or cobblestone appearance of the mucosa. Serosal involvement may result to adhesion, stricture with fibrosis, intra-abdominal abscesses, fistulas, and rarely free preparations, skip lesions may appear. Fat wrapping, a feature of Crohn's disease that is grossly evident and is helpful in identifying affected segment of the intestine during surgery. This represents encroachment of the mesenteric fat onto the serosal surface of the bowel. This finding is virtually pathognomonic of Crohn's disease. In ulcerative colitis, inflammation is limited to the mucosa and submucosa. In Crohn's disease, there is full thickness of the bowel wall. In ulcerative colitis, inflammation is continuous and characteristically involves the rectum. In Crohn's disease, there are skip lesions and usually spares the rectum. It is always important to remember that ulcerative colitis is a disease of the colon but can involve the distal ileum known as backwash ileitis. The most common site of involvement in Crohn's disease is the terminal ileum and cecum. Iliocolic Crohn's disease, followed by the small intestine, colon, then rectum. Clinical manifestation. Most common symptoms include abdominal pain, diarrhea, sometimes bloody, and weight loss. The onset of symptoms are insidious, and the severity follows a waxing and waning course. Weight loss, fever, growth retardation are occasionally sole presenting features of Crohn's disease in children. May present with symptoms of acute appendicitis, small bowel obstruction, intra-abdominal abscess, free bowel perforation, perianal abscesses, and fistulas. 3 classification. A. Fibrostenotic disease. B. Fistulizing disease. C. Aggressive inflammatory disease. 80% have small bowel involvement, 30% have terminal ileitis exclusively, 20% of cases are seen in colon alone, 5 to 10% isolated perineal and anorectal disease. Uncommon sites of involvement include the esophagus, stomach, and duodenum. More in females, common on the 3rd decade, and there is a second smaller peak on the 6th decade of life, but can be seen in early childhood through the entire lifespan. Risk, genetics and environmental factors. Smokers, higher socioeconomic status are high risk. Breastfeeding lowers the risk. Because of the insidious onset, diagnosis of Crohn's disease is typically made only after symptoms have been present for several years. Clinical history: acute or chronic abdominal pain, especially when localized at the right lower quadrant, chronic diarrhea, intestinal inflammation and radiography or endoscopy, stricture or fistula in the bowel, histological evidence of inflammation or granuloma. Differential diagnosis: ulcerative colitis, irritable bowel syndrome, mesenteric ischemia, collagen vascular disease, carcinoma and lymphoma, diverticular disease, infectious enteritis. Typhoid enteritis, Mycobacterium tuberculosis may present like Crohn's disease. Cytomegalovirus may present intestinal ulcers, perforation, and bleeding. Crohn's diagnosis: no single test result is enough for your doctor to diagnose Crohn's disease. They will begin by eliminating any other possible causes of your symptoms, making a Crohn's disease diagnosis as a process of elimination. Diagnosis: clinical history plus endoscopic, radiographic, and pathologic findings establish the diagnosis. No single symptoms, signs, or diagnostic test establish the diagnosis of Crohn's disease. Colonoscopy with intubation of the terminal ileum main diagnostic tool, showing cobblestone and skip lesions on the area. Other diagnostic tests: barium with small intestine follow-through, CT enterography, MR enterography, CT scanning, esophagogastroduodenoscopy, and capsule endoscopy. Antibody test: anti-neutrophil cytoplasmic antibody and anti-Saccharomyces cerevisiae antibody. Your doctor may use several types of tests to make a diagnosis. Blood tests can help your doctor look for certain indicators of potential problems such as anemia and inflammation. A stool test can help your doctor detect blood in your GI tract. Your doctor may request an endoscopy to get a better image of the inside of your upper gastrointestinal tract. Your doctor may request a colonoscopy to examine the large bowel. Imaging tests like CT scans and MRI scans give your doctor more detail than an average X-ray. Both tests allow your doctor to see specific areas of your tissue and organs. Your doctor will likely have a tissue sample or biopsy taken during an endoscopy or colonoscopy for a closer look at your intestinal tract tissue. What causes Crohn's disease? It isn't clear what causes Crohn's disease. However, the following factors may influence whether you get it: your immune system, your genes, your environment. People with Crohn's are also more likely to develop intestinal infections from bacteria, viruses, parasites, and fungi. This can affect the severity of symptoms and create complications. Crohn's disease and its treatments can also affect the immune system, making these types of infections worse. Yeast infections are common in Crohn's and can affect both the lungs and the intestinal tract. It's important that these infections are diagnosed and properly treated with antifungal medications to prevent further complications. Treatment for Crohn's disease. A cure for Crohn's disease isn't currently available, but the disease can be well managed. A variety of treatment options exist that can lessen the severity and the frequency of your symptoms. The goal of treatment is to palliate symptoms rather than to achieve cure. Medical therapy is used to induce and maintain remission. Nutritional support, either enteral or parenteral route, is part of the treatment regimen. Medications. Several types of medications are available to treat Crohn's. Anti-diarrheal and anti-inflammatory drugs are commonly used. More advanced options include biologics, which use the body's immune system to treat the disease. Which medications or combinations of medications you need depends on your symptoms, your disease history, the severity of your condition, and how you respond to treatment. Anti-inflammatory drugs. The two main types of anti-inflammatory drugs doctors use to treat Crohn's are oral 5-aminosalicylates and corticosteroids. Anti-inflammatory drugs are often the first drugs you take for Crohn's disease treatment. You typically take these drugs when you have mild symptoms with infrequent disease flares. Corticosteroids are used for more severe symptoms but should only be taken for a short time. Immunomodulators. An overactive immune system causes the inflammation that leads to the symptoms of Crohn's disease. Drugs that affect the immune system, called immunomodulators, may reduce the inflammatory response and limit your system's reaction. Antibiotics. Some doctors believe antibiotics may help reduce some of the symptoms of Crohn's and some of the possible triggers for it. For examples, antibiotics can reduce drainage and heal fistulas, which are abnormal connections between tissues that Crohn's can cause. For patients with perianal disease, metronidazole or ciprofloxacin 2 to 4 weeks is the primary step. Antibiotics can also kill off any foreign or bad bacteria present in your gut that could be contributing to inflammation and infection. Glucocorticoids are also used for mild disease. Thiopurine antimetabolites, azathioprine, 6-mercaptopurine, used for severe disease. Biologic therapies. If you have severe Crohn's, your doctor may try one of a number of biologic therapies to treat the inflammation and complications that can occur from the disease. Biologic drugs can block specific proteins that may trigger inflammation. Infliximab, example of antibody treatment. Perianal disease, ciprofloxacin or metronidazole 2 to 4 weeks or longer. Azathioprine is used for relapse. Fistulas, infliximab and azathioprine are drugs of choice. In ulcerative colitis, removal of affected intestinal segment may be a cure. In Crohn's disease, it is impossible to remove all intestines at risk. Therefore, surgical therapy is reserved for complications of the disease. Surgery. If less invasive treatments and lifestyle changes don't improve your symptoms, surgery may be necessary. Ultimately, about 75% of people with Crohn's disease will require surgery at some point in their lives, according to the Crohn's and Colitis Foundation. Some types of surgery for Crohn's disease include removing damaged portions of your digestive tract and reconnecting the healthy sections. Other procedures repair damaged tissue, manage scar tissue, or treat deep infections. Indications for surgical treatment: acute onset of severe disease, failure of medical therapy, development of disease complications like obstructions, perforation, complicated fistulas, hemorrhages, and malignancy risk. Segmental intestinal resection of grossly evident disease followed by primary anastomosis is the procedure of choice. Stricturoplasty for obstructing lesions to prevent short bowel syndrome. Frozen sections are not necessary. Primary anastomosis if medically stable, nutritionally replete, taking few immunosuppressive medications. Creation of a stoma if hemodynamically unstable, septic, malnourished, receiving high-dose immunosuppressive therapy, and extensive intra-abdominal contamination. Crohn's colitis may present as fulminant colitis or toxic megacolon. Initial treatment, resuscitation and medical therapy, bowel rest, broad-spectrum antibiotics, and parenteral corticosteroids. If unresponsive, total abdominal colectomy with endoileostomy, elective proctectomy if refractory proctitis, iliorectal anastomosis if appropriate. Annual surveillance colonoscopy with biopsy for long-standing Crohn's disease, more than 7 years. Dysplasia is an indication for total proctocolectomy. Intraluminal ulceration should be biopsied to rule out neoplasia. Intestinal bypass procedures if mobilization is unsafe. Dietary changes. Food doesn't cause Crohn's disease, but it can trigger flares. After a Crohn's diagnosis, your doctor will likely suggest making an appointment with a registered dietitian. An RD will help you understand how food may affect your symptoms and what diet changes may help you. Using this information, the RD will help you create eating guidelines. These dietary changes should help you absorb more nutrients from the food you eat while also limiting any negative side effects food may be causing. Crohn's disease diet. A diet plan that works for one person with Crohn's disease may not work for another. This is because the disease can involve different areas of the GI tract in different people. It is important to find out what works best for you. This can be done by keeping track of your symptoms as you add or remove certain foods from your diet. Lifestyle and diet changes may help you reduce the recurrence of symptoms and lessen their severity. Adjust your fiber intake. Some people need a high fiber, high protein diet. For others, the presence of extra food residue from higher fiber foods, such as fruits and vegetables, may aggravate the GI tract. If this is the case, you may need to switch to a low residue diet. Limit your fat intake. Crohn's disease may interfere with your body's ability to break down and absorb fat. This excess fat will pass from your small intestine to your colon, which can cause diarrhea. Limit your dairy intake. Previously, you may not have experienced lactose intolerance, but your body can develop difficulty digesting some dairy products when you have Crohn's disease. Consuming dairy can lead to an upset stomach, abdominal cramps, and diarrhea for some people. Drink water. Crohn's disease may affect your body's ability to absorb water from your digestive tract. This can lead to dehydration. The risk for dehydration is especially high if you are having diarrhea or bleeding. Consider alternative sources of vitamins and minerals. Crohn's disease can affect your intestines' ability to properly absorb other nutrients from your food. Eating high nutrients food may not be enough. Talk to your doctor about taking multivitamins to find out if this is right for you. Work with your doctor to figure out what best suits your needs. They may refer you to an RD or nutritionist. Together, you can identify your dietary limitations and create guidelines for a well-balanced diet. Talk to your doctor if you are interested in trying any of these treatments alongside your current regimen. Popular alternatives treatment for Crohn's disease include the following. Probiotics. These are live bacteria that can help you replace and rebuild the good bacteria in your intestinal tract. Probiotics may also help prevent microorganisms from upsetting your gut's natural balance and causing a Crohn's flare. Scientific data about effectiveness is limited. You can find a wide selection of probiotics supplements online. Prebiotics. These are potentially beneficial materials found in plants such as asparagus, bananas, artichokes, and leeks that help feed the good bacteria in your gut and increase their numbers. Prebiotics are also available to buy in supplement form. Fish oil. Fish oil is rich in omega-3s. According to a 2017 study, research is ongoing regarding its possible treatment of Crohn's disease. Oily fish like salmon and mackerel are rich in omega-3s. You can also try fish oil supplements which you can shop for online. Supplements. Many people believe certain herbs, vitamins, and minerals is the symptoms of a variety of diseases, including the inflammation associated with Crohn's disease. Research is ongoing as to which supplements may be beneficial. Aloe vera. People believe that aloe vera plants has anti-inflammatory properties because inflammation is one of the key components of Crohn's disease. People often use it as a natural anti-inflammatory. However, there is no current research that suggests aloe vera helps with Crohn's disease. Acupuncture. This is the practice of strategically sticking needles in the skin to stimulate various points on the body. One theory is that acupuncture may cause the brain to release endorphins, chemicals that block pain and strengthen the immune system. A 2014 study found that acupuncture combined with moxibustion, a type of traditional Chinese medicine that involves burning dried medicinal herbs on or near your skin, improved symptoms of Crohn's disease. People with active Crohn's disease reported less stomach pain, diarrhea, and inflammation after getting acupuncture. Crohn's surgery. Surgery for Crohn's disease is considered a last resort treatment, but 3/4 of people with this Crohn's will ultimately need some type of surgery to relieve symptoms or complications. Once medications are no longer working or side effects have become too severe to treat, your doctor may consider one of the following surgeries. Strictureplasty widens and shortens the intestine in an attempt to reduce the effects of scarring or damage to the tissue. During a bowel resection, portions of damaged intestines are removed. Healthy intestines is stitched together to reform the intestines. An ostomy creates a hole through which your body can eliminate waste. These are usually performed when a portion of the small or large bowel is removed. They can be permanent or temporary when your doctor wants to give your intestine time to heal. A colectomy removes sections of the colon that are diseased or damaged. A proctocolectomy is surgery to remove the colon and rectum. If you have this surgery, you will also need a colostomy, a hole in the large intestine for emptying waste. Crohn's disease. Surgery is helpful for relieving symptoms, but it's not without its risks. Abscesses are small pockets of infection, and they can contain fluid, dead tissue, and bacteria. Fistulas are unusual connection between your intestines and other parts of the body, or between two loops of your intestines. Abscesses and fistulas occur when your bowel are inflamed or injured. Fistulas and abscesses occur in about one-third of people with Crohn's disease. Abscesses often need to be drained or surgery may sometimes be suggested. Antibiotics for Crohn's disease. Several antibiotics medications can be used in Crohn's disease, both to treat the disease itself and its complications. They include Metronidazole, used alone or in combination with Ciprofloxacin. Metronidazole is commonly used to treat complications such as abscesses and fistulas. It may also help reduce disease activity and prevent recurrence. Side effects of metronidazole may include numbness and tingling in your extremities and muscle pain or weakness. It is important to be aware that drinking alcohol while taking metronidazole may also cause side effects. Nausea and vomiting may occur, as well as an irregular heartbeat in rare instances. Make sure to contact your doctor if you experience any of these symptoms. Ciprofloxacin. Ciprofloxacin is also prescribed to fight infection in people with Crohn's. Consistent levels of medication in the bloodstream need to be maintained at all times, so it is important not to miss doses. Tendon rupture can be a side effect, although this is rare. Other possible side effects include nausea, vomiting, diarrhea, and abdominal pain. Refaximin. Refaximin has been used for years to treat diarrhea. However, it has recently emerged as a promising treatment for Crohn's disease. Possible side effects may include skin rash or hives, bloody urine or diarrhea, and fever. Refaximin may also be costly, so it's important to ensure your insurance covers it before picking up your prescription. Outlook. Antibiotics may help control your symptoms, but they may not affect the progression of Crohn's disease. In some cases, people stop taking antibiotics when they feel the side effects of the medication may be more severe than Crohn's symptoms. Remember, everyone responds to treatment differently. Be sure to discuss your option with your doctor to find out if antibiotics may be effective for you. Medications to treat Crohn's disease. One of the primary ways that you can manage Crohn's disease is through medication that suppress your immune system and reduce the inflammation in your GI tract. When you have Crohn's or other IBD disorder, the immune system has an abnormal inflammatory response that will cause your symptoms. The goal of taking medication to lower your immune response is to help your symptoms and give your GI tract a chance to rest and heal. Corticosteroids. According to the National Institute for Diabetes and Digestive and Kidney Disease, corticosteroids are steroids that help to reduce both inflammation and your immune response. They are often used as a short-term treatment. Common corticosteroid use to manage Crohn's include budesonide, hydrocortisone, methylprednisolone, and prednisone. The side effects of corticosteroids can include glaucoma or increased pressure in your eyes, swelling, high blood pressure, weight gain, higher risk of getting an infection, acne, mood changes. Serious side effects such as loss of bone density, osteoporosis, or liver issues can occur if you take corticosteroids for more than 3 months. Because of this, your doctor may have you take corticosteroids for only a certain period of time. Aminosalicylates. Aminosalicylates are often used to treat ulcerative colitis, but may be prescribed for Crohn's as well. These drugs are thought to reduce inflammation in the intestine lining to ease symptoms. These medications can be taken as a suppository, by mouth, or as a combination of both. How you take the drug depends on where the disease affects your body. What are the variations of Crohn's disease? There are six variations of Crohn's disease, all based on location. They are gastroduodenal Crohn's disease, mainly affects your stomach and the duodenum, which is the first part of your small intestine. About 5% of people with Crohn's disease have this type. Jejunoilitis occur in the second portion of your intestine, called the jejunum. Like gastroduodenal Crohn's disease, this variation is less common. Ileitis is inflammation in the last part of the small intestine or ileum. About 30% of people with Crohn's disease are affected at this location. Iliocolitis affects the ileum and the colon and is the most common variation of Crohn's. Approximately 50% of people with Crohn's disease have this variation. Crohn's colitis is found in about 20% of people with Crohn's disease. It affects the colon only. Both ulcerative colitis and Crohn's colitis impact the colon only, but Crohn's colitis can affect deeper layers of the intestinal lining. Perianal disease affects about 30% of people with Crohn's. This variation often involves fistulas or abnormal connections between tissues, deep tissues infection, as well as sores and ulcers on the outer skin around the anus. Crohn's disease and disability. Crohn's disease can disrupt your work and personal life. It can also cause financial stress. If you don't have health insurance, and sometimes, even if you do, your out-of-pocket expenses can total several $1,000s per year. If the disease becomes severe enough that it's affecting your daily life in a significant way, consider filing for disability. If you can prove that your condition prevents you from working or has prevented you from working for the last year, you may be eligible to receive disability income. Social Security disability. Insurance or Social Security income can provide this type of assistance. Crohn's disease in children. Most people with Crohn's disease are diagnosed in their 20s and 30s. But IBD can develop in children too. Approximately 1 in 4 people with an IBD show symptoms before age 20, according to a 2016 review. Crohn's disease that only involves the colon is common in children and adolescents. That means distinguishing between Crohn's and ulcerative colitis is difficult until the child begins showing other symptoms. Proper treatment for Crohn's disease in children is important because untreated Crohn's can lead to growth delays and weakened bones. It may also cause significant emotional distress at this stage in life. Treatments include antibiotics, aminosalicylates, biologics, immunomodulators, steroids, and diet changes. If you like this channel, please subscribe, like, and click the notification bell. Thank you.